Hello, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. For the next few months, we're going to be doing bonus episodes, and we're hoping to release them every Friday, highlighting students from each of the schools and colleges of podiatric medicine. Today, we have 3 students representing the Kent State University College of Podiatric Medicine. All 3 are members of the American Podiatric Medical Students Association, otherwise known as the APMSA. I'd like to introduce each of them individually. First, Mr. Eric Flaherty in the class of 2025. I know Eric because he's the APMSA liaison to the American Association of Colleges of Podiatric Medicine. Welcome, Eric.
Dr. Jensen, how are you?
I'm doing great. And Ms. Sierra Clark, also in the class of 2025. Welcome, Sierra.
Thank you. It's an honor to be here.
And Mr. Jeff Nerestant, also in the class of 2025. Welcome, Jeff.
Hi, good evening, Dr. Jensen. Pleasure to be here.
Well, thanks for joining me. One of my goals in doing these episodes is to discuss your educational experience and give prospective students a glimpse of what the Kent State University College of Podiatric Medicine is all about. So to get started tonight, Jeff, if you wouldn't mind, please share with our listeners what podiatric medicine is.
Absolutely. Podiatric medicine is a medical and also a surgical specialty that focuses on the ailments and pathologies of the lower extremities of the human body. And that really encompasses the biomechanical, musculoskeletal, neurovascular, and dermatological aspects of the lower extremities. And it's important to note that podiatric physicians always establish very close and long-term relationships with their patients, and especially the diabetic patient population. Additionally, podiatry in itself is a specialty, but there are also multiple subspecialties in that specialty. So if a student wants to pursue a subspecialty in sports medicine, dermatology, or diabetic foot care, podiatry allows you to do that. So essentially, someone who decides to pursue a career in podiatric medicine decides to be ultimately a clinician and a surgeon at the same time.
Well said. Well, great description. And Sierra, if you wouldn't mind, can you describe the educational pathway to becoming a podiatric physician?
Yeah, definitely. So to become a podiatric physician, one must complete an undergraduate degree and pre-medical coursework, usually consisting of classes such as biology, chemistry, and physics. Then they must go on and take the MCAT. Along the way to pursuing a podiatric medical degree, it is also helpful to get involved in extracurriculars. And I would say things you actually enjoy doing. It's okay if you're the captain of the soccer team, whatever it is, you can make a way that transitions to show your skills and how to apply to medicine. You can also volunteer, shadow, and get as much exposure as you can. Even if it's not exactly in the field of podiatry, it all links in, and it's great to have that exposure coming in. And it's a 4-4-3 model. It's 4 years undergrad, 4 years podiatry, and 3 years residency.
Wow, well said. And then I was also going to mention that once you're done with 3 years of residency training, there's also an opportunity to do fellowships too. So that's also something that prospective students should be thinking about. Well, that's great. Well, thank you. So to set the stage for discussing the college, I'd really appreciate it if each of you could share your podiatric journey to date, where you're from, your undergraduate institution, how you found out about podiatric medicine, and how you specifically chose Kent State as your school of choice for your education. Eric, would you mind going first?
So I was born and raised in Massachusetts, and I began having problems with my feet when I was about 12, 13, 14 years old. And so I was in and out of the podiatry office throughout high school. It caused a lot of problems playing soccer. So being in and out of there and seeing just how good my podiatrist, Dr. Capozzi, was with me, and getting an opportunity to shadow him. And then eventually, while I was an undergrad at Stonehill College, which is a small college in Massachusetts, I got the chance to intern with a Dr. Scott Aronson for a couple months, which was a phenomenal experience. Getting to spend a couple of days a week in his office, seeing numerous different pathologies, as Jeff mentioned earlier. And that solidified my interest in becoming a podiatrist. And what brought me to Kent State was just a comfortability level of the area, and having a great interview with our biochem professor, Dr. Tim Whittingham, who was phenomenal in the interview. It was such a very comfortable environment where it felt like a natural conversation between him and I, and he showed a genuine interest in getting to know me. And it's somewhere where I felt like I really wanted to be. And then after getting here, it further became even more solidified as to me making the correct choice and finding a great friend group and just all the opportunities that Kent State has provided me. And yeah, I mean, it's been a great journey so far. So.
Oh, fantastic. And Sarah, would you mind sharing your journey to Kent State University College of Podiatric Medicine?
Yeah, so I'm originally from Ohio. I'm a native. I completed a dual degree master's and bachelor's program in public health at Kent State University. And then I always knew I wanted to go into medicine, but it was a series of events that kind of led me to podiatry throughout my life. And I may not have realized it at first, but it all came together. So when I was very young, my grandfather had a blood clot in his leg. And unfortunately, while he was being treated, he developed compartment syndrome and had to have an emergency fasciotomy. So through that procedure was life-saving, but he did have some problems with ambulating later in life, but he always found ways to work through that. My grandmother took great care of him, making sure, his feet were well taken care of. He was putting on his braces that he needed. And, he was able to lead an active lifestyle. And then through my life, like I said, I wanted to go into medicine. In high school, I had a diving injury where I met my first podiatric physician, and they really helped me with perineal tendonitis. And that was hugely impactful. And then how I got to Kent State and to podiatry too is I was actually doing cancer research at the time, and the podiatry school reached out to me and said, you could be a candidate here. And we'd love to set up shadowing. And I went ahead and did that. I had a great time. I was amazed by how all the different specialties that I had been looking at before fit into this one field that, it could involve pediatrics to geriatrics. It can involve dermatology and surgery and all these different things that I was interested in. So I didn't feel like I needed to pick, I didn't have trouble picking a specialty because I could do it all in podiatry. So that's what brought me to Kent State, having that opportunity. And what other medical school is going to set up shadowing for you?
No, that's brilliant. And shadowing is so important. We'll talk about that in a couple minutes. Jeff, can you share with us your podiatric journey?
Absolutely. My journey started way back when I began playing soccer at the age of 3. So my father was my soccer coach, and I would also see him on the field when one of our teammates or players would have an injury. Sometimes they would sprain their ankle or twist their ankle playing. They didn't know they had sprained it, but my dad would go to them and tend to them and assist with wrapping, ace wrapping, and also looking at my soccer journey, if you will, as a child. I sustained a lot of injuries in my ankle and my toes, wearing cleats that were too tight, sometimes because they looked nice. I wanted to wear them, and that was damaging to my feet. And I started learning about podiatry throughout that process, not specifically about podiatry, but about medicine in general and the foot and ankle ailments. So that kind of sparked an interest in that specific area of the human body. And I started researching. And during my free time with my dad, we were talking about different fractures and watch soccer games together and see different injuries and even comment on those injuries, how players would twist their ankles, whether it's eversion and inversion. I was learning at that time, and I didn't know that. Fast forward to undergrad, I went to Valencia College in Orlando and also attended the University of Central Florida, where my advisors or pre-med advisors would also start talking about foot and ankle injuries, and there's some of the workshops, and that kind of, I would say, strengthened that interest and made me more curious about the foot and ankle in general. And one of my aunts, she is a podiatrist. She went to NYCPM. And one time she came over and I was sharing my interest with her in medicine. And she asked me, what specialty, what part of medicine do you want to go to? And I started sharing with her that I'm really interested in surgery in the foot and ankle. I'm really interested in treating pathologies in the foot and ankle. And I didn't know that there was a specialty that really takes care of just that part of the body. And then I had an aha moment. So the light bulb went on when she told me, hey, I'm a podiatrist. This is what I do. I can see patients in clinic, and I can also take them to the OR to perform surgeries. And at that time, I told her, this is what I want to do. And she connected me with some of her friends who are podiatrists in Orlando, and I started shadowing them. And I quickly understood how much of a balance that the schedule of a podiatrist allows them to have in their life and their personal life and their professional life as well. And so that kind of sold it to me there. And as far as Kent, I was researching schools to go to and to pursue my podiatric medical career. One of the highlights of Kent State was the fact that there were so many clubs and the student body was so involved when I started learning about them. And because I was so involved in undergrad, I was part of the Wellness Ambassador team, and I was also a student leader. And to me, that was an environment I wanted to, I told myself I would thrive in because I was familiar with it. And so with all of that Kent had to offer during the interview, learning about what they have to offer in terms of clubs and organizations, and also the mentor-mentee relationship they have, which is called the Big and Little family, where you have an upperclassman that's going to support you all the way throughout your medical career at Kent. So that was a no-brainer for me to choose Kent over all the other pediatric medical schools.
That's great. It's interesting that so many of our students that go into podiatric medicine have either experienced injuries in sports sometime in their life or a family member, or they have that outstanding shadowing experiences. And you've had all three of you have had both. Can you comment on the shadowing experience? Because a common theme I see in our profession is that students are shadowing all the different health professions, but when they go to podiatry, they find a doctor that's very happy, very content, very satisfied with his career. And I contend it's because they do what they like to do. They can specialize in areas that they want to. Can you each comment, just a short comment on your shadowing experience and what it meant to you? Jeff, please continue.
Absolutely. So I started shadowing this podiatrist was from Temple. His name is Dr. Ugo Adigweme. The first time I went there, he was in private practice at the time, and he welcomed me, and the environment there was so friendly and so welcoming. And his patients were always having some friendly conversations with him. So he made his patients at ease from the get-go. So he would always come in scrubs. He told me about the white coat syndrome, that some patients would, first time they see him, their blood pressure would go up, and even if they were to come in for a simplest thing, maybe just a routine nail care, they probably would feel a little bit uncomfortable seeing him with a white coat. So that I learned by shadowing. The first time I shadowed a podiatrist, I didn't know about the white coat syndrome beforehand. In addition to that, he kind of went through the process of going through medical school and residency and clerkship. So he was a mentor to me. And I started learning about residency programs during my first shadowing experience, during my first visit. So he not only touched on the educational aspect and the training of becoming a podiatrist, but he also taught me some bedside manners and soft skills that I needed, or I also always need to interact with my patients, and ensuring that whenever the patient comes to see you the first time, you make sure that that first encounter, that first experience is one to remember, to allow them to feel comfortable. And that way their treatment plan can also go accordingly. And with those non-compliant patients, sometimes it's hard when you don't have that relationship with the patients, don't have the relationship with the physician, and it makes it hard on the patient to follow through their treatment plan. But once they've established a good relationship early on, it's an easier process for their treatment moving forward.
Excellent. Eric, how about your shadowing experience?
So I started by shadowing my podiatrist, Dr. Kokosi, who I mentioned earlier, and the other podiatrists in his office, Dr. Kaminsky, Dr. Brown, and Dr. Peacock, and just noticing how happy they were with their daily life. Of course, it can be a little stressful being in medicine, but having a very good work-life balance on top of being able to develop very strong relationships with the consistent patients that you see every 9 weeks for those specifically the diabetics that you see. And when I was with Dr. Aronson for a couple of months, just noticing how happy he would get when a patient would be very happy with a procedure. I remember one time he received a letter from a patient who he had done a procedure on, who was then able to start skiing again. And just noticing how good they were with their patients, their attention to detail. I know one time Dr. Aronson picked up on the fact that like a little girl, her parents were divorced and she never even said it. And it was something that really caught me off guard. And it just seeing like how strong that relationship was, even with new patients, was something that really drew me to the profession. And just again, the day-to-day of you have your consistent diabetic nails, but just every day you see something different type of pathology, whether it's dermatological, neurovascular, musculoskeletal, et cetera, was such a draw, on top of the fact that seeing the post-ops, I never got to see any of them do surgery, but knowing that you could go into a field where you can do surgery and from day one that you will be a surgeon as long as you do what you're supposed to do is such a major draw for our field.
Oh, I agree. You do indeed know you're going to be surgically trained from the first day of podiatric medical school. And that's a sharp contrast from MD and DO programs where it becomes kind of a crapshoot for the specialties down the road. Sierra, tell us a little bit about your shadowing. Now, you actually shadowed at Kent State at their clinics, right?
Yes, I did. And so most of my interactions were first from students. And so that was really interesting because, I got a full look into what their lives were like. They were very honest and they told me all about how much they loved the program, how happy they were going into this. They took me through patient visits and they taught me how to present to the attendings. I got to talk to the attendings about their lives and what they enjoyed about this specialty. And as I alluded to before, I had shadowed a lot of different specialties before, and I was really kind of stuck on figuring out if I want to be in the clinic or surgery. I didn't really think I could do both. I wanted lifelong relationship with patients and see them year after year, but I also wanted to be a surgeon. So coming to the clinics at school, I got to see that there was an opportunity to do both those things and to kind of specialize in any direction I wanted to. So it was an amazing experience, and I'm so glad the school gave me that opportunity.
That's a great opportunity. So the three of you are leaders in your class. You all represent the APMSA. How did you get involved with APMSA? And in that involvement, what are your responsibilities? Eric.
So APMSA is the American Podiatric Medical Student Association. We represent all students from all now 11 schools across the country. Each school elects a delegate for each class, on top of having an alternate delegate, and the student body presidents, such as Jeff, attend our biannual House of Delegates meetings. For me specifically, I've never really been involved in any type of leadership position prior to coming to Kent State. Just not something that I ever really involved myself in. I've always been very socially awkward and not really put myself out there. But our fourth-year delegate, Harold Brabon, really pushed me to run, and I took it upon myself to do some research and run for the position, and I happily won the position. And therefore, and then in APMSA, I've then taken upon the role of running for the AACPM liaison. So in APMSA, you can run for different liaison positions, such as Sierra being the APMA Political Action Committee liaison, or the APMA BOT liaison, and plenty of other liaison positions. And you can also be the head of a committee, such as the Education Committee, the Communications Committee, the PR Committee, and we all do a lot of work, whether that's issues directly affecting students, such as our boards exam, or even national issues affecting the podiatric medical field at large. So we have a very large impact, whether that's locally or nationally.
Well, I speak for everybody at the AACPM that we enjoy having you as part of our meetings, and you represent the student body extremely well. So congratulations. So Jeff, you're the student body president. How'd you get involved with APMSA, and what are your specific responsibilities?
Right. Excuse me. So yes, I currently hold the position as of the president of OPMSA, which is the Ohio Podiatric Medical Student Association. So it's similar to the Student Government Association at every school. In my role as the president of OPMSA, I'm also a voting member of the House of Delegates of APMSA. So that's how I got involved in APMSA. Not only am I always actively engaged and involved in discussions and conversations locally and nationally that go into the best those conversations are for the best interest of the student body, but also I am always part of reaching out or working with the presidents of the other schools to create or to work on events that would always benefit the student body as well. And what I'm alluding to is what we call the Academic and Athletic Conference, which is an annual event that's hosted by the APMSA, organized by the presidents of the schools, of the podiatric medical schools. So it's an event that allows all the students to come together to get engaged in educational programming and also through an athletic tournament. So historically speaking, a basketball tournament was the sport that was being highlighted during this conference. So this upcoming conference, which would be held in Tampa, Florida, in winter 2023 at the midwinter House of Delegates, we're still working on the sport aspect, the athletic aspect. So there may be a difference for this year. So I would encourage your viewers, Dr. Jensen, to stay tuned and keep in touch with APMSA on social media, as well as OPMSA, to stay up to date on what's going to be happening during the midwinter. So in addition to working with the student body presidents of the other schools, there are also victories I'm involved in locally at a state level. So one of the things I'd like to share, and for prospective students, is to know that Kent State is one of the schools that just received a state subsidy for tuition purposes. So as part of my role as the OPMSA president and also the entire OPMSA board, we play an advocacy role on behalf of the student body. So because of that advocacy, and also with the support of the Ohio Foot and Ankle Medical Association, our faculty and staff at Kent State, and also a lot of students from our student body, we were able to get that state subsidy, which our school has been missing for a while. And now it would allow students who attend Kent State to benefit from a reduction of at least $13,000 on their tuition annually.
Wow, congratulations. That's some major advocacy, is right. Well done.
Thank you.
Sierra, your role with APMSA and how you found out and how you got involved and what your responsibilities are.
Yeah, so before coming to KSUCPM, I was part of a national organization called Scientista, and we organized symposiums that brought women in STEM together from across the country. So I learned about APMSA. It sounded like they had some of the same goals and bringing together podiatric physicians from all the different schools. So I was very interested in applying, and luckily I got the alternate delegate role, and I've been thrilled to have it. I've been able to run to be the APMA PAC liaison, which is the Political Action Committee. I'm very involved in legislation, so I'm also on the secretary of the legislative committee. And within the Political Action Committee, I get to run a student committee for them too. So they're very involved. They want to know the interests of the students. And to all the students out there, please look into APMA PAC. There's a lot of ways to get involved. And if you have any questions about advocacy, they should all be there. So.
Oh, well, thank you very much. Well, congratulations on your roles and your elected positions. And I think our future of our profession's in good hands with leaders like the three of you. So let's transition into the everyday schooling, first year, second year, third year, preparing for clerkships. Jeff, do you want to touch base on what the first year experience is for students? And then Sierra, if you wouldn't mind talking about the second year, that'd be great.
Absolutely. I'll be more than happy to. I remember 2 years ago when I was starting or even going through orientation, I was looking at the curriculum and the roadmap, and I was telling myself, oh, this looks heavy. This is a very intense roadmap or curriculum for the first year. So what I'd like to share before I dive into all the credits and the classes that students would go through during their first year is for any students out there, any prospective student, when looking at the roadmap on the KANT's website, it may look intimidating and may look challenging at first. However, once you start that first class, once you go to your first day of class and seeing the support, the amount of support you get from your peers and also your upperclassmen, it would feel very different in reality. So with the first year, there are 3 semesters, fall, spring, and summer. And during the first year, there are 23 credit hours that are broken down into different classes like human anatomy or gross anatomy, embryology, cells and tissue, staying alive. Those 2 classes, cells and tissue and staying alive, they're under the umbrella of biochemistry. So they're split into 2 classes within the first semester. There are also medical genetics, medical ethics, principles of medical research. So you get to learn about research if you're interested in research on your very first semester at Kent State. And we have faculty members that are currently involved in research that can either point you into the right direction or recommend you a mentor to work with, or they would be working with you starting on your first semester at Kent. And we also have a class that helps us as professionals, as young professionals, called it's Podiatry, Professionalism in Society 1. So that's the classes that a prospective student will be taking on the first semester of the first year. Second semester, which is the spring semester, you start diving into more of the lower extremity anatomy. So that's the major class. That's a highlight of the second semester of the first year. We do have lower extremity anatomy, neuromuscular systems, cardiovascular, renal and respiratory systems, as well as medical immunology and microbiology. So the spring semester is also a bit intense. What I would also and note is that we have tutoring throughout the first year for all of our students. So upperclassmen, second year, third year, even fourth year students will be tutoring during the lunch hour and also in the evening once classes are over. So those first 2 semesters, fall and spring, you will get all the help that you need to go through those successfully. And to end the first year, it ends with the summer semester, which consists of biomechanics 1, rehabilitative medicine, lower extremity physical assessment and diagnosis, as well as introduction to medical imaging.
Wow, a busy first year. Very good.
Absolutely.
Sierra, so when you come out of that summer semester, what's the second year look like?
Yeah, so second year is interesting because you kind of step out of podiatry and you're learning a lot about other fields of medicine. You're learning pathology and pharmacology, but we're also learning more specific things to podiatry. We had a podiatric medicine class. We have more radio classes and biomechanics. And in our spring semester, we start doing podiatric medical skills where we get to do more hands-on things. So that's very exciting to, I think, all of us as second years. Yeah.
Oh, there you go.
That's my friend's foot.
Eric's showing one of our casts. So, and so then we're getting into more skills, also surgical skills, learning how to scrub, learning how to go ahead and suture. So it's a really great experience, and getting that hands-on classes are really fun. And we also have a preclinical competency course in the spring, which kind of helps prepare us for boards.
Excellent. So once the basic sciences are over and you take boards, then it's back into the clinical world, right? Eric, do you mind sharing what the clinical opportunities and experiences are in the third year as you prepare for clerkships in the fourth year?
Yeah, of course. So we took boards on July 7th, and then so that was a Friday. July 10th is when we start our third year, so Monday. So we started clinic right after boards. So it depends on whatever rotation group you're placed in. So each student is placed in a group for both third year and fourth year, different groups, and your group rotates through different rotations. So you will have a Pod Med 1 and a Pod Med 2 rotation, which is focused mainly on treating podiatry. Some students will have special rotations in their Pod Med 2 rotation when you're at this Indy clinic, which is a clinic in the school. So you have wound care, or you might even have a physical therapy rotation for a week. You will have a surgical skills rotation. You will have a radio rotation where you learn radiology for a month. You have 2 months of surgery. You will then have a primary care or VA rotation. And then you have a wound care rotation. And then you have 2 months of simulated patients. So you are seeing basically fake patients where you are learning how to do proper patient interviewing and proper deductive reasoning with what the patient is presenting with in order to come to a conclusion as to what the condition that they have is. In conjunction with this, throughout your third year, you're also taking classes such as medicine, neurology, dermatology, behavioral medicine, pediatrics, podiatric surgery, etc.
So a little combination of classwork and clinic. That's excellent. And then just for the listeners, in the fourth year, when students start doing clerkships, January is a big month because in January they have boards part 2 and in the fourth year, and there's residency interviews because match day for residency is in March. So it's busy schedule there, no doubt. Let's take a couple fun minutes and do some professor shout outs. Sierra, who have you had as a professor over the first couple of years that you've really appreciated and would like to give a shout out to?
Yeah, so all our professors are amazing. I was very excited to get the hands-on experience. So I would like to shout out Dr. Johnson and Dr. Blazer. It was great in the podiatric medical skills to get hands-on and learn from both of their perspectives. I think they both have different strengths, and it was nice to learn from both of them. They work so well together, and it was just a joy to be in that class.
Fantastic. Eric, professor shout outs.
My favorite professor in my first couple of years has to be Dr. Scott Spencer. He is a phenomenal biomechanics professor, and he does a very good job at making biomechanics interesting and very easy to follow. And he's very good at making jokes and occasionally roasting students, which is very entertaining.
And you develop a thicker skin, right? Very good. Jeff, professor shout out for you.
I think I have a long list. I'll try to keep mine very short. First year, I'd say Tim and Joanne. The first semester, these two professors are incredible, and they break down the complex material very make it very easy to follow, to understand. So Tim and Joanne definitely in the first year. And also I discovered the how would I put this? The gem. I'd call it a gem. I can't say it. His name is Dr. Butler, Dr. Nicholas Butler. He's very helpful in clinic. He's very approachable in the classroom. So if anyone has come to Kent State and they haven't met Dr. Butler, I'd encourage us to meet Dr. Butler.
Fantastic. Well, thank you. So, and all work and no play doesn't work, right? So I know you're busy, you're taking exams, there's a lot of stress. What do your classes do together to relax after exams? Or are there organizational events that you do? How does Kent State work in that regard? Eric.
So Kent State has many clubs and activities that you can do. I know Jeff will definitely speak upon that when he gets asked this question as the APMSA president. Me specifically, I really enjoy using our gym that we have on campus. So you will find me in there after exams, getting a stress relief workout in. And I think it's a great resource to have. The school also has a free subscription for students to a gym called FitWorks, which has multiple locations near our school, which students are welcome to use and encouraged to use. And I know that my friends and I very much enjoy after exam week sitting down and watching UFC fights. It's a kind of another nice stress release, watching people beat the crap out of each other. So like this past weekend, we watched UFC fights. Sadly, my guy Dustin Poirier lost, but it is what it is. So.
Well, very good. Well, hey, we need to recharge the battery. Sierra, what do you do to recharge your battery and with your classmates?
Yeah, so my classmates and I love to get outside in Cleveland. We have a national park here in our backyard, and we all happen to have dogs. So we go on our puppy hikes, we call them, and we all get out in nature and do that. And we also like enjoying, there's plenty of restaurants and sporting events. So there's always opportunities around Cleveland to do something fun when you have the opportunity to.
It's great. And I always, whenever I go to Cleveland, I go to the Rock and Roll Hall of Fame. I think that's always a great event also. So Jeff, as the president, what are you organizing for all your classmates?
Oh, there are so many opportunities to unwind and relax after exams. At the club level, first of all, we have so many clubs that students always find something to do with their specific club. But also as OPMSA, we put on events. Recently, we had, that was spring of our second year, we had a multicultural event where different students with different backgrounds had to showcase their cultures through food, music, clothing, and which was a well-attended event. And the student body was received very well by the student body. And coming up, this fall semester, we'll be having what we call the Flash-a-Palooza at Kent State. It's going to be a club fair where incoming students and even current students can come in and learn more about the clubs and in a very relaxed atmosphere. So there, besides the clubs and OPMSA, we also have small student groups within the college that get together as well outside of Kent. There's a Top Golf nearby, which is even in walking distance by the school. And we also take our friends or classmates to games, Cavs games. We've been to a few Cavs games over the past 2 years, as well as the Cleveland Metro Park Zoo, which is a very well-visited spot by Kent students. And one of the events that recently took place was a Walk to Remember, which was hosted by the Hospice of the Western Reserve. And a lot of students went to volunteer. So there are many volunteering opportunities for us after exams, whether it's put on by OPMSA or our clubs on campus, SNAPMA, the Sports Medicine Club, and Pete's clubs. And so a lot of clubs they're so active that there's always something to do after exams.
That's great. So I'd like each of you to answer this question. What would you tell a prospective student that wants to go into podiatric medicine about Kent State? Sierra, would you like to start?
Yeah, so I would say that hopefully when I graduate, I'll be a third-time graduate from Kent State. So I love the area, and I really like the podiatric medicine campus. It's in Independence, so it's nearby Cleveland, but it's still kind of in the suburbs, so you can have the best of both worlds, whatever you prefer in that respect. I would also say if you come to Kent State, you're going to make lifelong friendships. You're going to have great opportunities here and things that are going to carry on through your career. So yes, of course, we're about academics, and the school does very well to prepare you and get you to the endpoint of graduation. But I think they also prepare you beyond that and getting you ready for your career as a podiatric physician.
Well said. Thank you. Jeff, what would you say to a prospective student that's considering podiatric medicine and going to Kent State University College of Podiatric Medicine?
The first thing I would encourage that student is to start early, start researching podiatric medicine early and start shadowing and reach out within the community to see how many podiatrists are there and how many are willing to welcome you into their clinic. And from there, pick their brains on where they went to school, what residency programs they did. I think it's important to start that conversation early on, even before starting podiatric medical, their podiatric medical education. And as far as Kent State, I would say to me, I wouldn't change anything about coming to Kent State, moving from Orlando to Ohio. I think that's one of the best decisions I've made in my journey, my life, and my medical journey. So I would highly encourage any prospective student to consider Kent State. There are so many reasons for that. We have a really robust mentor-mentee program within the student body. So when you come to Kent State, you will not be alone. You'll be in a family and you'll feel supported. And we also have a very supportive staff and faculty that's always there with an open door policy to have conversations not only about the academics, but also about your personal lives and also guide you into the right path on so many levels, whether it's professionally, even personally, and at any aspect, through different aspects of your life. So Kent is one of the schools, one of the pediatric medical schools out there, but it's also very unique in a sense that it provides so many opportunities academically, research wise, as well as on the humane aspect.
Well said. And Eric, I give you the final word. What would you say to a prospective student that's considering podiatric medicine and going to Kent State University College of Podiatric Medicine?
Podiatry is a phenomenal field that you will not regret coming into. As I mentioned earlier, you are guaranteed to get some surgical experience and have the opportunity to do surgery in the future. You get a great work-life balance with a very, very solid salary, which of course is very important for everybody. And you get very, very, very high quality relationships with your patients, which is a phenomenal thing, which is highly rewarding. As to going into podiatry, I think it's very important, as has been mentioned repeatedly, to shadow. I know when I've been with podiatrists, a big thing that they say is, if we can get them in the door, we got them. So that is a very important thing, and it will open your eyes to this wonderful field that isn't as well known as it should be, but we're working on getting it to that point. As for Kent State, it is a phenomenal place that I do not regret whatsoever coming to. I have met some of my best friends that I will hold for my entire life, specifically 4 of them that are just wonderful. And even beyond that, people that aren't my bestest of friends, but people like Jeff or Sierra, who I know that in the future, if I ever need anything, I can reach out to them, or even now, and they'll be there to help me. We have a phenomenal institution here with great tutoring resources that are available to you. We have a phenomenal anatomy lab with phenomenal professors, great clinical opportunities. We have the wonderful Cleveland medical system, such as Cleveland Clinic, which will have access to. such as during your fourth year, one of the senior med rotations you can get is with Cleveland Clinic Vascular. And there's so many wonderful opportunities that this school provides you that will help you and give you great experiences, not only in the now, but that will help you tremendously in the future.
Oh, well said. Well, that's exciting times, and I want to wish all three of you the best of luck moving forward in your podiatric journey. And I'm always proud of our students in our profession taking leadership roles. I commend you for that also, because you're doing that on top of the academics, and my hat's off to you. And to all of our listeners out there, if you're listening on Spotify or Apple Podcasts, please give us a 5-star rating. If you're on YouTube, we'd love to have you subscribe. And until we talk again, and I'm sure we'll be connecting throughout the next several years, don't be strangers. And I know cups, these Dean's Chat cups have gone out to each of you. Enjoy those. And until we meet again, cheers, everybody.